So the Discseel procedure has been around for quite some time, pretty much like 5 or 6 years at this stage of the game. It was initially developed as an adjunct or an alternative to, invasive surgical procedures that are designed for what we call discogenic pain. So in many cases, when patients have symptoms of what they call sciatica or leg pain, especially as it relates to the low back, usually that's coming from a very specific condition. So it's an injury or damage to a disc that's causing irritation to a nerve root. And historically, in the traditional model, if they fail in physical therapy and interventional pain fails to provide a long-term outcome in terms of injections, then typically that would be a surgical case where they're going in and they're cutting a piece of the disc out to relieve the pressure on the nerve and essentially get rid of the leg pain. But what comes with that is not only that it's an invasive procedure, it requires general anesthesia, and it requires removal of tissue. The problem with those types of procedures is not that they're not successful, because in many cases they are at solving for the leg pain. But for the most part, down the road, we tend to see accelerated degenerative change because we're removing tissue, we're destabilizing the segment, and ultimately there is some ramification or some downside that occurs as a result of that. So in an ideal world, what the Discseel procedure allows us to do is to repair tissue rather than remove tissue, and we can do it in a very minimally invasive environment. And the thing about minimally invasive, we throw that term around quite often, and minimally invasive surgeries are still surgeries. There's still incisions and there's still removal of tissue, but it's done in a minimally invasive fashion. But in this case, there are no incisions. We're actually just using needles to repair the disc as opposed to remove the disc. And what that allows for is it allows for recovery immediately following and a faster recovery in terms of symptomatology. So the Discseel procedure, very simply, is an injection protocol, and it's both diagnostic and therapeutic. So diagnostic in the sense that we're doing what's called an annulogram. So, when we have a disc herniation or a slipped disc, there are various terms for it, or even a disc bulge, those typically come with what we call annular tears. And what that really means, and again, we go back to the same analogy with the jelly donut, and I don't love that one, but think of a jelly donut, right? So essentially, if the donut portion of that jelly donut tends to become damaged, then the jelly can leak out. That's not really the best analogy, but at the end of the day, what happens is the disc is made up of two primary components structurally. There's an outer ring that's called the annulus. This is the very fibrous ligamentous portion that gives it its shape and qualities. And then on the inside, there's a gelatinous material that also gives it some properties. That's just how it's made up. Now, when that outer ring is able to become torn or damaged, then that inner material can migrate towards one side or another typically, or kind of straight back. It just depends on the presentation. But what also happens is we get seepage of that inner material, and it really inflames the nerve roots where they exit the spine. And typically what comes with that would be what we call radiculopathy or leg pain, especially as it relates to low backs. So what a Discseel procedure allows us to do from a diagnostic perspective is an annulogram is a needle that we inject directly into the disc using video fluoroscopy, obviously done by a specialist. And once we put the dye into that disc, it really allows us to visualize where those tears are in the annulus. And then the seal component of the Discseel procedure is we basically inject an FDA-approved product that is designed to work with your body, and it actually seals the disc material itself. So as a result, we can see resolution of disc herniations, and more importantly, what the Discseel procedure has been proven to do as well is to regrow or to regenerate the disc material also. So it really gives us a unique opportunity to not just repair tissue, but also to improve the tissue long term and prevent the degenerative process from developing that would typically develop if we just left disc herniations alone or if we cut them out. This video may bring up a lot of questions, and if you have some, go ahead and leave some in the comments. I'm happy to answer. Or if you have detailed questions about your specific condition, you can reach out to our office and we're happy to answer them.